उनके लिए यहाँ पे
give a huge round of applause. On behalf of Guru Kashi University, Talwandi Sabo, we extend our
This sacred ritual embodies our collective aspiration from darkness to light, from ignorance to wisdom. May the light of Islam guide us toward deeper understanding, compassion, and commitment to mental well-being.
let this flame symbolize our resolve to dispel stigma, to kindle hope, and to affirm our dedication to human dignity and mental health rights.
Good morning and a very warm, respectful welcome to Honorable Dr. Justice Padut Ranjan Sarangi, Member, National Human Rights Commission, New Delhi, and former Chief Justice, High Court of Jharkhand, Honorable Chancellor Sir Sardar Gulab Singh Sidhu ji, and Ms. Shri Jagdish Bishnoi ji, SP Headquarters, Bhatinda, and our esteemed invited experts, speakers, senior police personnel who have kindly joined us for this seminar, respected Pro-Vice Chancellors, Director Campus, Deans, Officers, distinguished faculty members, and dear students. At the outset, it is a privilege to welcome you all to the Guru Kashi University
and former Chief Justice, High Court of Jharkhand. Honorable Chancellor Sardar Gulab Singh Sidhu ji, always available guiding force for organizing such programs. Guests of honor, Shri Jagdish Bishnoi ji, SP Headquarters, and those who are connected with us, Shri Kamlesh Kumar ji, IPS District and Session Judge, cum Chairman DLSA, Bhatinda, Shri Harjeet Singh ji, IPS, DIG Bhatinda Range. So we are regularly getting guidance from them. Honorable dignitaries sitting on the dais and off the dais, distinguished guests, esteemed speakers, faculty members, scholars, students, ladies and gentlemen, a very good morning. It's my privilege to warmly welcome you all to the National Seminar on Right to Mental Health, Bridging Gaps in Access, Awareness and Advocacy, organized in collaboration with the National Human Rights Commission. At Guru Kashi University, our vision is empowering youth, empowering nation. And when we talk of youth, the most concerning factor that is of relevance today is mental health and the stress in social system which they are facing. So accredited with NAC A++ and ranked among the premier universities in the country, we are honored to join hands with the National Human Rights Commission to address one of the most urgent human rights concerns of our time. The right to mental health addresses an issue that touches every family, every institution, every community, and it is this shared concern that has brought us together today. Mental well-being is not a privilege. It is a fundamental human right and a cornerstone of a dignified life. The magnitude of the challenge before us is immense. Global estimates indicate that 1 in 8 people express or experiences a mental health situation. In India, the situation is equally pressing. According to the World Health Organization, 56 million Indians live with depression and 38 million people struggle with anxiety disorders. Behind each statistics lies a human story. A student overwhelmed with academic pressure, a professional battling burnout, or an elderly person enduring isolation and loneliness. The huge participation of law enforcement personnel, the police people, in this gathering, so that indicates that they are a very much concerned segment of the society that themselves are facing a huge pressure at workplace. I am reminded of a student who once shared, "I used to think asking for help meant I am weak. I was weak. When I finally spoke to a counselor, I felt like someone has opened a window in the dark." So that means such simple experiences remind us that a single conversation can transform a life. Early intervention saves lives, and it must be recognized as a basic human right. Despite progress, many challenges persist. Stigma continues to silence countless individuals who need help the most. Families often miss early signs. Persistent sadness, withdrawal, irritability, disturbed sleeps, until circumstances escalate. Our youth are increasingly vulnerable, burdened with rising academic expectations, social media pressures, and fast-paced lifestyles of today. Yet, mental health conditions are treatable and manageable. We must know it. Solutions begin with awareness, empathy, and open dialogue. We must promote early counseling, create safe spaces in educational institutions. We have at Guru Kashi University School of Happiness for that purpose. Strengthen workplace well-being systems and encourage healthy practices such as mindfulness, physical activity, and balanced living. Michelle Obama, the First Lady of the United States, once said, "We would never ignore a broken leg, so why we ignore a broken spirit?" So India has taken commendable steps with the Mental Health Care Act 2017, which upholds every citizen's right to accessible mental health services, dignity, privacy, informed consent, and protection against discrimination. This landmark legislation reinforces that mental health is not optional, it is essential. It is a matter of great pride and delight that Dr. Justice Vidyut Ranjan Sarangi ji is gracing the occasion today as a chief guest.
My esteemed Chancellor, S. Gurlab Singh ji Sidhu, respected Pro Vice Chancellor, Professor Jagter Singh Dhiman, the Nodal Officer Dr. Amit Tuteja, and other dignitaries on the dais and of the dais, and above all, my dear students. Really, I am honored and privileged to be remaining amongst you in this auspicious occasion of 2 days national seminar on the right to mental health, bridging gap in access, awareness and advocacy, organized by Guru Kashi University, Talwandi Shamu. Really, I am been told that you are all blessed because this institution has come out with the blessing of Guru Gobind Singh. And this is a place where Guru Gobind Singh has enshrined his Granth Sahib, remaining here for 9 months. That is why you are lucky enough to have this institution and to have your education from this institution. I really owe my gratitude to the Vice Chancellor and Chancellor of this university who are taking care of you very nicely. And simultaneously, I must say that district administration and also the police people, they are giving due security to you all to have a smooth study atmosphere in this entire place. When I moved from Bhatinda, though initial program was Bhatinda, I was asked that why the location so that you can go and see, but it is told by your nodal officer that it is 30 kilometers away from Bhatinda. This is another pleasure for me to know that at least you have an academic atmosphere here. Without spending time outside, you can spend time within the campus and the knowledge. And more particularly, I must express my thanks to all these teaching and non-teaching staffs of the institution, those who have dedicated themselves for your growing. And I am happy and I can vision that you are the future generation of the country and you are in safe hands. Therefore, the things which are going on at your university is definitely a beacon light for other universities, so that at least the flow of education should continue from this place. I am really happy that this university is conducting this seminar with the aid and assistance of the National Human Rights Commission for 2 days in the subject right to mental health, bridging gap in access and awareness and advocacy. At least you must be knowing what is the role of the National Human Rights Commission and how it has come, and what is the necessity to have this discussion today or tomorrow with all the dignitaries, those that are participating from different parts of the state and of the country, and their expertise in the subject itself definitely enlighten you to have knowledge and to have some deliberation and to know about the situation, how and where we are. The thing is that if you talk of human rights, then I can have vows to say that human rights is inbuilt within our heart, inbuilt within body, inbuilt within us from the date of inception itself. Reason being that we are a country, that India, the Bharat, is a land of himself. Nowadays, the things have come up in such a manner that if a child is sonography test knows that she is a girl child, there is no difficulties to spoil that, but we are the person, we have to save them irrespective of the male or female child which is in the womb of the mother. Therefore, the right which is accrued in favor of the fetus of the mother, that has to be protected by us and by you and by all of us. Therefore, the thing is that the human rights is a thing, even if child is not born, it creates a right within as a fetus from the mother's womb and continues till he dies. Every day in and out, you can find out that the human rights of a particular person is always continuing. Suppose as a student, I am saying that if you are not reading, your teacher can tell you that you are not reading. Bring up their children. So each and every stage you can find out that there is a relationship between the human being with exchanging each other. Therefore, now if you think of this same, that these are the things we are doing every day practically, but it has not been codified. Universal Declaration of Human Rights came in 1948, and that has been adopted by UN in 207 resolution, where Article 3 and Article 7 incorporates 4 things, that is equality, liberty, freedom and dignity. So by that time, the India has not seen its independence, nor it is, but it was in process of preparing its constitution. Their matter was placed before this committee who was under consideration for preparation of this constitutional committee, who is preparation of the constitution with the leadership of Baba Sahib Ambedkar. Then their due deliberation was made after due deliberation from different parts of the countries, people have participated, and Article 14 which says about the right to equality, Article 19 which says about the right to freedom, then Article 21 which says about the right to live with dignity. Therefore, these have been incorporated in our constitution in written form. Our constitution is a very, very sacred document, and our democracy survives on that, and we survive on our constitution. We respect our constitution, we respect each and every word of our constitution, and it gives us enough right to survive with a dignified manner. Therefore, now coming to the question of this mental health, I can point out that since every person has a right to live with dignity, that is Article 21, the right to free environment, free life, free education, and what not. Then everything, if I've got the better environment, better water, better light, better air, and better forest, and everything around you, if you can get comfortably, that comes within the meaning of the right to health, and the right to health provides many things which can be considered in different way. Therefore, when we talk of mental health, I have my consideration to this extent that many of the persons, including myself, I am not free from mental disturbances. So to have a peaceful mental life, it requires a thought. Reason being, I am saying that how I am being affected by this mental peaceness. Suppose I have large number of work to do. Though I have to synchronize myself, I have to understand myself, then I have to rationalize my timing, I have to do something. That the pressure which I am carrying on, that itself is a mental pressure, and the mental pressure leads to your mental health. If it leads to mental health, ultimately you are being affected. Therefore, all types of people are being affected with mental health, but to maintain that health condition proper, we have to have some guidelines, and we have to have some curriculums, and we have to have some theories to follow. Therefore, not merely any person who is suffering from any diseases of mental or disorder can be classified as the mental health conditions, but I think I don't agree with this such view. That is one part of the issue where a person suffers from mental disorder or mental difficulties, or somebody is not been asked by his family members, or somebody is not been taken care of, and the child is suffering from mental disease from childhood. That apart, we all are suffering from mental disturbances. Suppose like a student, if you are under pressure to do something, if my thoughts have been imposed on you, saying that you should be a lawyer, you should be a doctor, you should be an engineer, but your mind is differently. I should be a good player, I should be a good jawan, I should be a good police officer. Then the mind pressure on you puts a mental harassment that I should not have done, because you are all students, you are on glowing stores, and that too I must allow you to grow in a way you like. It is not that I should impose thoughts on you to do what I want. Rather, the parents have been requested not to impose their thoughts on the children to grow what they like. Rather, the children has to grow himself. Somebody wants to be a good artist. Maybe he wants to do some cinemas, he wants to do some dramas, if he wants to do some artwork, then in that case you allow him to grow in his own way so that he can explore his future and he can go to last extent of his thoughts and reach the pinnacle of his success. Therefore, everybody who suffers from mental health, mental disturbances, that we have to take care. I am giving one example to you that I had been to Airwada Mental Health Center at Pune, which is Asia's biggest mental health center. I find that different class of persons have been admitted there, and they have been taken care of by many of the people of the institution, and I find that some people, even if they recover, their family members are not taking up, saying that he is mentally ill, that we are not taking up. But we have to create an atmosphere where the person who was cured are not being accepted as a family member, they should remain comfortably with all dignity. Therefore, the entire endeavors of ours should be that everybody should remain in a peace and calm manner with all dignity in all atmospheres. That is why the endeavor is today's and tomorrow's seminar is that how to protect their interest of this mental health sector and how we are proceeding with the things which is required to be done. Even if I say that the Supreme Court has taken into consideration the mental conditions of different persons and passes judgments, mere passing judgments cannot do unless it is implemented. It remains only a paper degree because of the reasons that if the judgment is implemented and this result is utilized, then only we say that the judgment is applicable and judgment has given its own force. Therefore, when the judge thinks of the matter and delivers judgment, his judgment should be respected and the same should be implemented with all letter and spirit. Thereby, the mental health center, even if the Supreme Court has tried their level best to do something best and passes order from time to time, but at some point of time it has got tired, say that we will now switch over our baton to the National Human Rights Commission to take into this consideration, to look after the matter and monitor everything. So thereby the National Human Rights Commission has come into picture to do something better in mental health sector, and that is why we are holding the seminars, we are holding the meetings, we are visiting the spots, we are visiting the hospitals, we are visiting the mental health centers to find out what is the necessity and what is the future course action of ours, so that people can be granted such benefits. And today the seminar which is going to open, which has been opened, that is one of the measure to have a greater perspectives for the future. And I hope and I trust that all the academicians, all these researchers, all these participants and all these motivators who are participating in this proceeding must give some good result to us and make a recommendation to do something better for future generation.
Honorable Chief Guest, Dr. Justice Vidyat Ranjan Sarangi ji, Member of National Human Rights Commission and former Chief Justice of the High Court of Jharkhand. Guest of Honor, Shri Karnesh Kumar ji, IPS District Session Judge and Chairman DLSA Bathinda, SP Headquarter, distinguished expert speakers, participants from Secretary, Law and Public Policy, esteemed judge, academician, police personnel, dignitaries and students. Ladies and gentlemen, a warm good morning. I extend warm welcome to all of you to this today national seminar on right to mental health, bridging gaps in access, awareness and advocacy, organized in collaboration with the National Human Rights Commission at Guru Kashish University, Talwandi, Sabo. We are all aware that mental health today is not merely a medical concern, it is a fundamental human right that shapes the dignity, productivity and well-being of every individuals. Yet barriers such as stigma, limited awareness, inadequate access, and policy gaps continue to prevent many from receiving the support and treatment they need. The seminar, therefore, is both timely and essential. Guru Kashi University is accredited with NAC A++, is committed to academic excellence, social responsibility, and research-driven engagement. Hosting this seminar aligns with our vision of empowering youth, empowering nation, and speaks of our dedication to addressing issues of national and social importance. Over the next 2 days, we will benefit from talks of eminent speakers representing diverse yet interconnected fields, leading psychiatrists working to bridge rural-urban mental health care gaps, legal scholars interpreting constitutional protections for mental well-being, experts from telemedicine and digital mental health innovations, policy analysts presenting forward-looking governance strategies, and psychologists and judicial officers who are strengthening awareness and community outreach. Their multidisciplinary perspective will help us understand mental health challenges and various dimensions and propose practical solutions for strengthening services, especially for high-stress groups such as police personnel, students, and other vulnerable communities. I extend a special welcome to the officers from the police department. Your work environment entails immense pressure and discussions. Such as these plays a crucial role in promoting resilience and mental well-being within the people force. I sincerely appreciate the efforts done by Pro Vice Chancellor, Campus Director, and Director of Students Welfare, and the entire organizing committee for their dedication in bringing this seminar to fruition. I offer my best wishes to each one of you for the success of this seminar. Thank you all, and Jai Hind.
Tireless effort in strengthening human rights and societal well-being. We now request. We also feel deeply privileged to honor Jagdish Bishnoi ji, SP Headquarter Bhitinda, whose integrity, judicial insight.
Along with our esteemed dignitaries, we also like to place on record our appreciation for the distinguished speakers of today.
We thank you all for your presence.
तव शुभ नामे जागे, तव शुभ आशीष मांगे, भारत भाग्य विधाता। जय हे, जय हे, जय हे, जय 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 हे।
Standing ovation, please.
ਅੱਜ ਗੁਰੂ ਕਾਸ਼ੀ ਯੂਨੀਵਰਸਿਟੀ ਦੇ ਵਿੱਚ ਜਿਹੜਾ 2 ਦਿਨਾਂ ਦਾ ਸੈਮੀਨਾਰ ਕਰਵਾਇਆ ਗਿਆ, ਇਹ ਮੈਂਟਲ ਹੈਲਥ ਅਵੇਅਰਨੈਸ ਦੇ ਉੱਪਰ ਕਰਵਾਇਆ ਗਿਆ। ਇਹ ਸੈਮੀਨਾਰ ਹੈ ਗੁਰੂ ਕਾਸ਼ੀ ਯੂਨੀਵਰਸਿਟੀ ਦੇ ਬੇਸਿਕ ਸਾਇੰਸ ਐਂਡ ਹਿਊਮੈਨਿਟੀਜ਼ ਡਿਪਾਰਟਮੈਂਟ ਵੱਲੋਂ ਕਰਵਾਇਆ ਗਿਆ, ਜਿਸ ਦੇ ਵਿੱਚ ਸਾਡੇ ਆਪਣੇ ਰਿਟਾਇਰਡ ਚੀਫ ਜਸਟਿਸ ਉੱਤਰਾਖੰਡ ਦੇ ਜਸਟਿਸ ਮੈਂਬਰ ਨੈਸ਼ਨਲ ਹਿਊਮਨ ਕਮਿਸ਼ਨ ਦੇ ਉਹਨਾਂ ਨੇ ਸ਼ਿਰਕਤ ਕੀਤੀ। ਔਰ ਬਹੁਤ ਹੀ ਅੱਛਾ ਜਿਹੜਾ ਅੱਜ ਦਾ ਸੈਮੀਨਾਰ ਰਿਹਾ। ਤਾਂ ਉਹਨਾਂ ਨੇ ਦੱਸਿਆ ਵੀ ਜਿਹੜਾ ਅੱਜ ਦੇ ਜਿਹੜਾ ਲਾਅ ਦੇ ਵਿੱਚ ਨਵੇਂ ਜਿਹੜੇ ਚੈਲੰਜ ਆ ਰਹੇ ਨੇ, ਉਸ ਦੇ ਉੱਪਰ ਮੈਂਟਲ ਚੈਲੰਜ ਕਿਸ ਤਰ੍ਹਾਂ ਜਿਹੜੇ ਹੈਗੇ ਨੇ ਦੂਰ ਕਰਨੇ ਨੇ, ਕਿਸ ਤਰ੍ਹਾਂ ਦੀ ਨਵੀਂ ਪਾਲਿਸੀਜ਼ ਬਣਾਉਣੀਆਂ ਨੇ, ਕਿਸ ਤਰ੍ਹਾਂ ਅਵੇਅਰਨੈਸ ਕਰਨੀ ਹੈ, ਇਹ 2 ਦਿਨ ਦਾ ਸੈਮੀਨਾਰ ਬਹੁਤ ਹੀ ਬੱਚਿਆਂ ਦੇ ਲਈ, ਖਾਸ ਕਰਕੇ ਲਾਅ ਡਿਪਾਰਟਮੈਂਟ ਐਂਡ ਜਿਹੜੇ ਦੂਸਰੇ ਬੱਚੇ ਹੈ ਉਹਨਾਂ ਦੇ ਲਈ ਬਹੁਤ ਹੀ ਯੂਜ਼ਫੁਲ ਹੋਏਗਾ।